Okay, well, good afternoon, everyone. Thank you for joining today's webinar. We are discussing the Office of the National Coordinator for Health IT's new challenge, the Digital Privacy Notice Challenge, which is actually a collaboration between ONC and HHS's Office of Civil Rights. Next slide, please. Great. So my name is Adam Wong. I am the project officer for the Investing in Innovation program here at ONC. We are also joined today by Penelope Hughes from the Office of the Chief Privacy Officer, also within ONC, Linda Sanchez from HHS's Office for Civil Rights, and Barbara Kingsley from Climbing Communication Group. Our agenda today is basically we will be going over kind of the background of the challenge, discussing HIPAA, OCR, model privacy notices, go through some of the challenge details, and then finish up with a question and answer period. We will be taking questions throughout the period in the chat, in the WebEx chat box. So please go ahead and put your questions there. We will be going through all of the short presentations first, and then tackling all of the questions at the end. So please feel free to start putting your questions in there. We will be going over HIPAA and OCR related questions first because we will not have one of our subject matter experts for the entire period. I would also ask that if you are not speaking, to please put your phone on mute. Next slide, please. I just want to give a quick word about Investing in the Innovation Program, or I2, here at ONC. The program was conceived in early 2010 as a means to engage the entire nation in the spirit of encouraging innovation in healthcare and health IT. And we do that by holding challenges and awarding prizes and really furthering the missions of ONC and HHS. Now, among the things that we really want to do is spotlight areas of high interest to ONC and HHS. And this can include highlighting specific programs, whether they be public or private, activities, new rules or technologies, and also issues of concern. We also seek to direct attention to new market opportunities. We want to see these challenges lead to a variety of technologies that improve health outcomes. And through challenges, we can also stimulate private sector investment and get more market attention flowing to areas that we think require more attention. Finally, we seek to increase awareness and uptake of new standards and data. And this can also include information about HIPAA and about privacy information like we are going to discuss today. So with that, I'd like to pass things over to Linda Sanchez.
And move to the next slide. I wanted to speak a bit about the reason we even have the privacy rule. Two of the key ideas embedded in the rule are that individuals have the right to know how their information is being used and shared, and that individuals should have the opportunity, within reason, to control that use and share. However, patients cannot, in a healthcare setting, have complete control over their information. Most of us are not clinicians, and we have to trust that our health information is being used for our benefit and perhaps for the benefit of others. The notice is one tool provided in the privacy rule to support those consumer rights. These notices must be given to patients and health plan members or anyone else who asks for them. And most importantly for this audience, if the entity has a website, the notice must be prominently displayed there. We're actually hoping that through this project, the contents of the notice can be integrated into entity websites and facilitate better patient communication. The slide tells you a little bit about what is required to be in the notice, how entities use the information, their duties, how to contact them with questions and concerns, etc. Next slide, please. So again, we do see this as an important tool for patient education and engagement in their care. The rule does require the notices to contain many specific pieces of information, which is what you will see in the model notices. There are some specific statements that need to be there, some rights that need to be covered, some uses that need to be described. And as you can see on this page, it does allow the individual to know about their rights, to get a copy of their information, to be informed how it's used and shared, to request how providers or plans communicate with them, and other important rights. I'm going to turn this over to Penelope now, who will speak specifically to the Model Notice Project.
Hi. So as Linda, and you can go to the next slide. As Linda explained, the Notice of Privacy Practice is a really important and critical document for communicating those key rights to patients. And so recognizing that, our office, the Office of the Chief Privacy Officer at ONC, we worked with the Office for Civil Rights to develop a paper-based model notice of privacy practices that providers and health plans could use that would really communicate this information clearly to consumers. And we all know that privacy notices of all types generally can be very difficult for folks to understand and digest. So as part of this project, we wanted the model notice to be user-friendly. It would be paper-based, and it would be customizable. So the final product, which we have in both an English language and a Spanish language version, is a set of fillable PDFs in 3 different designs, plus a text-only version that covered entities can take and then customize and give those to their patients and customers. And so because this model paper-based notice is serving as the foundation for the current challenge, I just wanted to stress a few things about it. First, as part of the development of the model notices, we did some background research to look at barriers to comprehension of notices by consumers, and to look at what was working for consumers and what wasn't working as far as notices go, and to really explore their preferences. And you will hear more about that in just a few minutes from Barbara Kingsley. We also used an iterative development process and design process, and so we went through multiple rounds of consumer focus group testing to really land on language as well as design elements that were working for consumers. And then importantly, we also made sure that we incorporated some new language that should be included in notices after some recent changes in the law. So for these reasons, we're asking participants in this project to use the language that was developed from the Model Notice of Privacy Practices project. So now I'm going to turn this over to Barbara Kingsley from Climate Communication Group. That's the firm that developed the model notices, and she's going to talk a bit more about the findings from the research and the implications for a digital notice.
Thanks, Penelope. As Penelope noted a few moments ago, we actually did quite a bit of testing of the model language as well as the notice drafts themselves. One of the places we started, however, was talking to stakeholders who were members of the industry, and we did focus groups with just typical consumers. And so I have summarized some of the findings here. Participants remember receiving MPPs, but generally don't read or use them. So when they get them in a doctor's office, they tend to maybe take them, but don't really read them. Participants really misunderstand the MPP. They believe that their health information will be kept completely private. So that's a misunderstanding on the part of consumers in general who we spoke to. Participants were surprised at the number of entities that could receive their health information and what entities will do with their information. They weren't always upset about what would be done with their information. I think they were surprised that anything would happen to it, given that they felt everything would be kept private. Even when participants trusted their doctors, they're fearful that entities receiving their information from their doctor might use it in ways that they did not anticipate. Participants were also very interested in the fact that they had rights when it came to their information. And in fact, that was one of the most salient findings of all of our testing, was that consumers really liked the fact that they had rights and could act on them. If you could go to the next slide. When we started the development of the actual paper documents, we had some directions we chose to take as a team, and this was based on a lot of the feedback from ONC and OCR, as well as the feedback we had gotten from stakeholders and consumers. So one of the most important was considering a layered notice because people weren't going to read everything. So finding ways to summarize important information up front. Another was to list the rights first before the disclosures, and this was based on the finding from so many consumers that they were really interested in rights and what they could do. We wanted to break out the rights, the choices, and disclosures, so things participants could do and things they had choices about, and then disclosures about what would happen to their information. We wanted to use specific design techniques to highlight important information that consumers really needed and to help them navigate the notice. We wanted to use a hook or a key message to gain consumer attention. And we also wanted to double and triple check language for the lowest possible reading level, so really making sure that consumers of all literacy levels could understand the notices. If we could go to the next slide. In our consumer testing, we did 4 rounds of English testing and 1 round of Spanish testing. And each testing, we were able to talk to 7 consumers in depth about what they felt about the model notices, and then in between each round we would make iterative design changes. And some of our testing results across all 5 of the testing sessions or testing rounds, that participants really liked the rights section. They did suggest changes at every level or every round. We had new changes, but they really appreciated the right information and could understand it well. Participants had the most concern about Section 2, your choices, and that is probably because of the conditional nature of a lot of the information. There were a lot of ifs, ands, or buts, and we did, I think, a good job of listening to consumers and clarifying that information. Participants overwhelmingly liked Section 3, our uses and disclosures. They found new information that they hadn't considered and recognized the positive nature of sharing. And participants really responded to certain design elements, bright colors, visuals that helped them navigate the information more easily, and a booklet approach. So all of that led to the development of the model disclosures, which can now, or model notices, which can now be found on OCR's website.
Okay, thanks, Barbara. So moving on to the real details of the challenge. So this is really a call for people to create an online model notice of privacy practices that is compelling, readable, and understandable by patients and is easily integrated into existing entity websites. So we want you to take the model language and formats and develop an effective approach to integrating them into an online interface. And so we have 3 primary requirements here. The submission must be coded in JavaScript for the interaction piece as a jQuery plugin, Node.js module, or standalone script, and be an HTML/CSS for the presentation layer. Use the content developed jointly by ONC and OCR that is available at the MPP website. And the of course, as Barbara just mentioned, the formatting and design elements were consumer tested and should be looked to as a guide, but successful submissions will factor in the differences between reading and consuming content on paper versus online. Lastly, organizations need to be able to customize the content consistent with the options made available through the paper-based model. So Penelope, can you maybe just briefly describe what kind of customization this might entail?
Oh, sure. So if you look at the paper-based model, you'll see where someone who's using it, a provider or a plan, can enter in some customized information. So that would include their name and address, but also things like any special notes about their practice. For example, if they do not create or maintain psychotherapy notes, that would be something they would want to put in there and customize. Or describing any state laws or other laws that they would need to include in there.
Great, thanks. Next slide, please. So here are the review criteria, 5 basic things. We'll be looking for the accurate use of the model content. Specifically, we don't want to see any deviation from the consumer tested language. The use of best practices in presenting web content for consumption. That includes the use of plain language, plain writing, in any kind of additional framing type language. The visual appeal, the capacity for the entity to customize content and link to other relevant entity content, as Penelope just described. And finally, the results from the public voting period. Next slide, please. So the challenge itself opened a few weeks ago, and the last day for submissions is Monday, April 7th, which is about 6 weeks from now. Winners will be notified on May the 1st and announced at a public event to be determined in May or June. Next slide, please. One of the more interesting parts, I'm sure. The first place prize is $15,000. Second is $7,000, and third place is $3,000. And in addition to the monetary prizes, participating in the challenge and especially doing well affords you recognition and publicity coming from the announcement of the prizes, follow-up from journalists frequently, and the ability to say that you won an ONC challenge. Next slide, please. So here's the website. It is oncchallenges.ideascale.com. If you have additional questions that you'd like to send over email, please contact Josh Shapiro. That's jshapiro@capconcorp.com. I should also mention that this webinar is being recorded and will be posted on the challenge website, and these slides will also be available. So with that, we are ready to move on to the Q&A period. Jennifer, do we have some questions queued up? And if not, we can go into some things that people frequently ask about.
Actually, Adam, I do not have any questions.
Oh, all right. That is fine. So I think one thing that is always worth noting when it comes...
I'm sorry, a question did come up, Adam. This is from Daniel Foster. What were the changes made to Section 1 during your focus group period?
I can handle that question. This is Barbara. In terms of our early rounds of testing, I would say we were simplifying the language.
Hey, Barbara, you broke up a little bit at the beginning there.
Okay, can you hear me now?
Yep.
Yes.
Okay. The biggest changes we made were in terms of simplifying the language. We initially started with a lot more language than we have now. It wasn't a matter of changing the legal or statutory elements, but just simplifying the language that we had. So when we took the language into the first rounds regarding rights, we found that people said, okay, I understand this, but it's still a little bit complex in terms of how it's worded. So we tended to try to eliminate words, help make it a lower reading level. And in some cases, we rearranged some of where the rights were depending on people's level of interest in the different rights. So those were the changes we made in the early rounds regarding that section.
Thank you, Barbara. I believe Linda had a comment that she wanted to make.
Hi, yes. Unfortunately, it doesn't really tie into the question that was just posed. But I wanted to mention on an earlier point that when we talk about customizing, it's not only the element that you see in the model notice. I think that this mode actually provides some opportunity to connect with other important information on an entity's website. For instance, large providers might be involved in clinical trials so that when they list that they may give information for research purposes, they can link to that important clinical trial information that they have on their website. Or if they say they use information for operations purposes, they can link to their quality assessment and improvement page. So these are all pieces of information that entities want their patients to know about, that they're proud about, or are important for them to know about, and this is a method for engaging them in that. And at the same time explaining a little more clearly how the information is used.
Okay, we also have another question. This is in reference to whether this could be submitted as HTML5 or CSS3. Are those acceptable? Can someone speak to that?
Nyan, you can correct me if I'm wrong, but HTML5 and CSS3 is okay.
Yeah, that's fine. And I would actually, I would sort of footnote that with depending on the provider systems where it's installed, if there's a certain browser requirement there, that may have to be reconsidered. But I think for the most part, it should be okay for modern browsers.
Great. So as we wait for any other questions to come in, one thing that I will note is that to be eligible to win a prize in this challenge, you need to be either a U.S. citizen or permanent resident, or be working on behalf of a company that is based in, has a central location in the U.S. However, if those do not apply to you, you can still participate and have your submission reviewed. So one question that we received last week was, if there is a difference between the language as it applies to healthcare providers versus health plans. Penelope, do you want to maybe address that?
Oh, yes, and there is a difference. There is some difference between the two, but I think we would want the submission to, in the sense it's customizable, be able to be used by either one, but obviously with the correct language being used depending on which one was being developed. If that makes sense.
Yes, thanks. And what about, any information in Spanish? Is that available?
Yes. I'm not sure anyone can hear me.
Yes, we can.
Okay, great. Yes, we do have Spanish language versions up on our webpage. They went up earlier this week, so people when the challenge first went out may not have seen them. It would be terrific if people could do the Spanish language versions as well, but that wasn't what we initially were considering.
Okay, great. Thank you. Jennifer, do we have any other questions or a final ask for any last thoughts?
I do not have any additional questions.
Okay. Well, in that case, thanks everyone. On behalf of ONC, we are really excited to be working on this challenge with the Office for Civil Rights, and especially looking forward to the exciting entries that will be coming in over the next month plus. So thank you very much, everyone, for tuning in today. And again, all the materials from today will be available at the website, onchallenges.ideascale.com. Thank you very much, and have a good afternoon.
Thank you.
Thanks.